Hello, this is Lisa Walker-Vischer, and this is my presentation for Nursing 576 Biostatistics. Today we'll be looking at primary nursing, a care delivery model for inpatient nursing. As a clinical nurse specialist, primary nursing is a topic near and dear to me and an excellent way to deliver care. Primary nursing was first developed in the late 1960s and first described in a professional journal in 1970 by Maria Manthe. She's really considered the mother of primary nursing, and it's been her life's work. It was a very revolutionary concept in its day because nursing had been very functionally based prior to that, with nurses having roles like being the medication nurse or the treatment nurse, or just delivering care as a team with no accountability across shifts or days. Primary nursing was really developed, though, in response to the fragmentation and deprofessionalization of nurses in this task-based perspective. No one nurse was responsible for the outcome of the patient or understood the whole story of the patient, and that's what Maria Manthe was trying to help with this primary nursing idea. She described primary nursing as a care delivery model where explicit responsibility and authority for specific patients were clearly allocated to a specific registered nurse whose license by the law permits independent decision-making about nursing care. Selleck, Russell, and Beckman, whose article we'll discuss in a few minutes, describe primary nursing as an organizational system of care which emphasized the delivery of comprehensive, individualized, and continuous nursing care through the nurse with authority and autonomy to plan and implement such care. Manthe says there's two essential components to primary nursing, and these are that you allocate 24-hour responsibility for each patient's care to one individual nurse, and secondly, you assign that nurse to the actual provision of her care, of the patient's care, whenever possible. And she thinks that's that simple to implement. In the last 40 years, though, there have been numerous studies looking at various aspects of primary nursing, but unfortunately, there has not been overwhelming evidence that this is the very best way to deliver care to all populations. It has turned out to be difficult to study for a variety of reasons. The article we'll look at today is by Selleck, Russell, and Beckman and was published in 2003. It's Primary Nursing, an evaluation of its effects on the patient perception of care and staff satisfaction, published in the International Journal of Nursing Studies. They did a quasi-experimental study that tested two hypotheses. Patients on the experimental or primary nursing unit would score higher on a patient satisfaction scale than those on a control unit, and nurses working on the experimental or primary nursing unit would rate their level of job satisfaction higher than nurses on the control unit. The study was conducted in a large hospital in Melbourne, Australia. They used two similar medical wards, and one was assigned to the traditional model and the other to the experimental group or the primary nursing model. Primary nursing was introduced, and 3 months later they started the study. The sample was made up of all patients in the two units that were alert and oriented, that could speak and read English, and were there at least 4 days. Nursing was all nurses in both units. Their instruments used were a patient questionnaire that was developed specifically for this study. It had 11 questions, and 10 of the 11 related to nursing care. Nurses used a staff satisfaction scale, also developed for the study. Both instruments were piloted prior to the study, but were not tested for reliability and validity. The procedure was that primary nursing was introduced for a 6-month trial period in the experimental unit. Data was collected after 3 months to reduce the novelty effect. All patients were administered the questionnaire on the day of discharge by a non-nursing researcher, and there were no refusals to participate, which is impressive. Nursing was given the staff satisfaction scale to complete the last 12 weeks of the study by, again, a non-nursing researcher. Results were anonymous and confidential, and again, there were no refusals to participate. Here are the numbers of both patients and nurses. In the control unit, there were 31 patients, and in the experimental unit, there were 28. There were 20 nurses in the control unit and 17 in the experimental unit, and this does represent 100% participation by both patients and nurses. Very impressive. The results, we'll spend the next few minutes talking about that. So the patient questionnaire has 5 questions with a yes/no response and 6 questions with a 3-point scale. One question was designed to elicit how many nurses the patient had in the last 24 hours. Frequency response for the 5 yes/no questions was analyzed using the Fisher exact probability test. And this test is used when you have 2 nominal variables and you have expected frequencies of less than 5 to be able to use this test. It's for those smaller groups. The one other question was analyzed using chi-squared since the response frequency was larger. While the number of yes responses was greater in the experimental group for all questions, only 2 questions were statistically significant. Differences in ranking were analyzed for the 6 remaining questions using the Mann-Whitney U-test for large samples. Mann-Whitney is a non-parametric test for assessing whether one of 2 samples of independent variables have larger values than the other. And while there was a higher mean rank on all questions except for question number 2 in the experimental group, 4 questions were ranked statistically significantly higher in the experimental group. In order to assess for job satisfaction between the 2 groups, the Mann-Whitney U-test was also used. So the mean rankings were higher for the primary nursing group on 17 of 23 items, and significantly different in favor of the primary nurse group in 3 items, and in favor of the control group in 1 item. Here are the questions that were statistically significant on the patient questionnaire. Has your nurse talked to a member of your family or friends about your illness and hospitalization? Significant at the 0.5 level. Did nurses spend time with you discussing your condition or illness? Significant at the 0.01 level. How well do you think the nurses understood you? Significant at the 0.005 level. How much interest did the nurses show as to the effects of your illness on your family? Significant at the 0.001 level. How much did the nursing care contribute to this? Related to the previous question, how did you like your stay? Significant at the 0.01 level. How well did the nurse help you prepare and plan for when you leave the hospital? Significant at the 0.01 level. The experimental group on the staff satisfaction scale had statistically significant questions of the chances you have to accomplish something worthwhile, significant at the 0.01 level, the opportunity to voice opinions, significant at the 0.025 level, the chance to take part in making decisions, the 0.005 level, and I set the pace at work, significant at the 0.05 level. The one question that was significant for the control group is, ironically, I have to work very fast, was significant at the 0.001 level. So they were feeling more pressed for time in the control group. So discussion really hinges on that this study does provide some support. The patients are more satisfied with the care they receive in a unit that has a primary nursing model delivery of care. The items that were statistically significant were related to being known and understood. Important things for us and from a very humanistic perspective. Less support that the nurses were more satisfied with their job in the primary nursing environment, but they did seem to be feel more included in decision-making, able to voice opinions, and that their work may be more worthwhile. So certainly some difference in how they are satisfied. There are significant limitations of this study, though. There could very well be investigator bias. They hypothesized that there would be a greater satisfaction for both patients and staff in the experimental group. They were clear about that in the beginning of their study. There's no randomization of patients or staff to either group, and there could be circumstances that affected how those units develop and how care was delivered. Primary nursing was relatively new to the experimental group. I'm currently implementing primary nursing in my pediatric unit, and we've been at it way more than 3 months and do not have it very well ingrained. So I think that time frame was very short for being able to say you were really doing primary nursing. The tools, unfortunately, there's no reliability or validity checks on them. They have been piloted only, so it's hard to say that they actually measure what you want them to. They do acknowledge that subjects did not answer all the questions and may need to redesign their tool to encourage more answers so you have a more complete data set. And then the timing of the questionnaire and discharge presents a problem because patients do not want to complain about staff while they're still physically in the hospital or to say their stay wasn't good. So that may have biased some of the results also. Overall, though, I think the study is a good attempt to evaluate the effects of primary nursing and certainly does show some mild support that patients feel more understood and heard, and that staff feels more empowered to make decisions and have a voice in the unit. We as a profession really do need to develop ways to systematically evaluate this care delivery model and other care delivery models in order to have evidence to drive our practice. Thank you for watching till the end. We appreciate your time. Enjoy your holidays. There's my reference list. Thank you so much. Oops.